The one leg circle, also sometimes called single leg circle, it's a very interesting exercise for especially beginner level clients because it's the first one that is asymmetrical. So, up until now, they have done a lot of symmetrical exercises, and this one is going to really challenge the stability, especially in the pelvis area. To start, I like to actually show them what is not stable. So, what I like to do, I have Sam here with me. Bend your knees a little bit and place your feet a little closer to your pelvis, and have your legs and feet hip width apart. So, I'm going to ask Sam to be in this position because this position shows how your pelvis can be very easily movable. So, whether or not is going a little bit forward and back, or posterior tilt, anterior tilt, or even just side to side, just to rock the pelvis side to side. And that way they feel actually how the pelvis is really more like a ball and it's not really flat and it's very easily movable. Sometimes I ask them to place their hand on the pelvis and challenge that stability when we work with one leg at a time. So keep your hands right there, Sam, and I'm going to utilize the straps that we have at the edge of the mat here for one leg. So I want you to take your left leg and place it under the strap so that you feel more stable with this leg, and flex the ankle and really feel that leg stay really connected to the mat, okay? We're going to extend the right leg up toward the ceiling. And at the beginning, I keep the leg a little bit low, so it doesn't have to be really high, but it does have to be extended. So instead of seeing the leg really high, bend your knee a little bit, the thigh really high, but the knee bent, that would not really help to really feel the movement in the hip socket. I really want to make sure that the client keeps the knee joint really extended. And if you need to lower the leg, they could be even a little bit lower than that. So with the hand position on the pelvis, I want to stabilize now the pelvis to make sure that nothing is moving. So you have to really engage your abdominals and make sure that you feel connected to the core. As you start the circle, you can turn the legs slightly turned out so that it's that the client looks towards the middle of the heel, here in the middle of the heel. And then you're going to start with this very small circle going toward the opposite side of the body, making the leg going across the body, and then a little bit up and then back to the center of the hip. So the hip is the center. When I say center of the leg with the hip, alignment with the shoulder is really the starting position. So when they start the movement, they go up toward the nose and then they go across the body. And then they come down a little bit and then they're barely going to be out to the side of the hip. And it's a very small range of motion at the beginning. Okay, again, because we're starting to challenge the pelvis movement there, and at the beginning it's extremely difficult to feel that one is moving, the thigh is moving, but the pelvis is not. And that would be the first level. So when your foot is underneath here, if they're also really extremely tight and they don't have a lot of flexibility, you can even bend the supporting leg just to pull a little bit more and loosen up a little bit on that side of the pelvis. Keep the pelvis nice and even, and then scoop to lift and then across. So it will be doing the same thing here, okay? What I like to emphasize at the beginning is to really going across the body, squeeze the inner thigh. So sometimes I put my hand in there between the legs and really ask them to squeeze the knees together to really feel the adductor muscle, the inner thigh muscles to really kick in. And I don't let the leg go so far out to the side. Okay, so they're doing more adduction than abduction. Okay, so really emphasize that. Usually we do 5 in each direction and then we reverse. So the reverse would be out a little bit, down as far as they can go and control, squeezing it on the way up, and coming back where the hip will be in the neutral position. So you're going to go up and down, across, and back to the center. Okay? Then eventually, when this is really comfortable, she's a little bit extended, and let's change the legs so Samantha doesn't get too tired on one side. You can then take the leg, go back again. Make sure that you keep that very stable. That's it. Now take the leg up. Good, that was better. And then from here, we're going to make it a little bigger. So let's say she's a little more advanced. She's a little more flexible, so she can go up, and really emphasizing again the muscles working together here. But also I'm going to challenge the circle a little bit more like a circle. At the beginning, it's almost like an oval, really, because we're going to go up and down in this direction, not so much out. So it looks more like a longer circle, so like an oval more than a circle. But now, if she's a little more advanced and her pelvis is stable, and Samantha, you can take the hands down on the side of the mat. I'm going to now flex the other foot on the floor and make sure that she feels that nice connection that she had before with the strap, but now it's without the strap. So you're going to go up to the nose, across, down to the foot, and then come back to the center. And again, up and touch the big toe right here with the heel. Squeeze your inner thighs. So even if it's a little bit advanced, I want to make sure she's still going all the way down to this range. And then challenge the outside of the circle, which is more abduction, right there, around and up. Now here is the breathing. Inhale across, exhale, come back up. Inhale, lift, cross it over and up. One more, inhale, lift, cross it over and hold. Now, if she's really connected and I see their stability is there, I want to really challenge now another motion, which is a little more advanced, which is actually going across and allowing the pelvis on that side to come off just a little. So she's almost rolling a little bit toward the right pelvis, how she's doing that whole circle back up. So she's going to go up and across over, feeling that nice stretch all the way around. And again, up, cross over, and open. Yes. And that's a really full range now. Here we go. Down and across, and then reverse. Lift, inhale, exhale on the way up. Inhale. And you always want to make sure that you see the beginning and the end of each circle, so that it's not just circling, but it has a beginner and an intention, and also the scoop of the abdomen each time. The leg comes up, and there's also a full breath incorporated with the coordination. Take the leg down and rest. Thank you. I wanted to go over a few modifications. As I mentioned to you at the beginning, the strap on the at the end of the mat is to help the client to stabilize the pelvis, especially if they're weaker in the powerhouse. But also we can use it for other situation or pathology. So again, if you have a knee issue or pelvis issue or hip issue, you can keep the leg bent. You can utilize the strap. You can also have the other leg standing on the floor. So if you let go the straps on your supporting leg, you can just bend your knee and then support the foot completely onto the mat here, keeping the knee bent. So that will facilitate maybe some discomfort on the low back or hip issues, and again, even just some of the knee issues. The other thing you can also keep in mind that the range of motion could be extremely small, but still very efficient. So do not skip the exercise. Do the best you can to just do the exercise with the same intention that we showed before, but also make sure that you feel that the leg is actually going in the socket. So you want to feel that the pelvis stays stable, but it's almost a feel that when you're grounding the salt into the mortar and the pestle, that you really want to go around the socket and have that kind of feel of just grounding and smoothing out everything that it's in that socket. So even if it's small, you want to really think about making that range very smooth. And you can do a few circles in one direction. So you can also, as a teacher, you could guide that client from the foot and making sure the pelvis stays stable. Then this knee doesn't roll and move on the other side. And they also feel the other foot really connected to the floor. So everything else is stabilizing, not just the pelvis, the arms, the shoulders, the spine, and everything else. And this could be a very small range, and it actually feels really nice for a lot of people. So also be careful when they feel that there's something clicking going on there. It could be this the pelvis or the sacrum iliac joint here, or inside the hip socket itself. So sometimes the rotation of the leg could be a little less. Maybe they're too externally rotated. So play with that a little bit and see if she needs to be a little more parallel, a little more turned out. But just check the pelvis and make sure that that is extremely even. Push that down a little more. There we go. Okay, so remember, small range, and then slowly take your time to really focus on that stability, and then eventually you'll be able to do a bigger circle.
Hello, my name is Dr. Joe Muscolino, and let's explore the biomechanics of this Pilates mat exercise, the single leg circle, also known as the one leg circle. So this exercise does many things that the previous traditional Pilates routine mat exercises do, but it adds another element entirely. But first, let's look at what's similar. Certainly, Sam here, our model, is imprinting her shoulder girdles down on the mat, and she does that with isometric engagement of the retractors of the scapula, such as the rhomboids, trapezius, especially middle trapezius, and that's so important to prevent that postural distortion pattern called upper cross syndrome, where we collapse forward. And she's also engaging extensors of the arm at the glenohumeral joint, such as posterior deltoid to hold the arms down, and she's engaging through the forearms and hands down onto the mat. So that's similar to other mat exercises we've seen. She's also having a long spine, so she's trying to reach out long and make space in the spinal joints, and that's a major tenet of Pilates always. So that is also similar. So what we're going to do here is she's going to bring, here we'll show the right thigh up into flexion to begin these circles. Now, when the thigh is up into flexion here, this is a sagittal plane motion, flexion of the thigh at the hip joint, and that is going to place a challenge to stabilize the core, to stabilize the pelvis. Now, let's just start with the idea here. We have her other foot in a strap here. And if the foot is passively held down with a strap, then her left leg is, her left thigh is, and therefore the left side of the pelvis, and therefore the entire pelvis is somewhat stabilized passively with this strap. And that is especially important for the beginner, the deconditioned client. But now let's take that away, okay? And now let's take a look at the way this exercise is basically done. So she's going to come up here, and again, sagittal plane, it's no different than what we've had before. Simona made a point that this is asymmetrical, and that is true, and that's one very interesting thing about this single leg circle exercise, but also the fact that she moves outward and or inward means that we're now adding another plane other than the sagittal plane, and that is fascinating to explore. Before we get into that, let's just make a point of how high up she goes. Simona made a point that the knee joint should stay extended. And that will be a challenge for some clients, especially middle-aged men that might have tight hamstrings. So you have to find that point of flexion of the thigh at the hip joint where they can keep the knee joint extended. And we'll work from there. The interesting thing, though, is the farther toward the mat they are, in other words, the less flexion she has of the thigh, the center of weight of her lower extremity moves farther away from the axis through the hip joint, which means that actually the leverage force on the stabilization of the pelvis increases. If they have the flexibility to go up higher, you can actually get, if she's up at 90 degrees, the center of weight of the lower extremity straight over the hip joint, and there's much less leverage force for stabilization. So the irony is that someone who's very tight actually starts with a bit more challenge by being down lower. So I wanted to bring that point up. But now we're going to get into the stabilization of the pelvis. Earlier we had the flexion of the thigh at the hip joint, the hip flexors engaging. And all hip flexor muscles also pull on their proximal attachment, which for all 12 of them, except for the psoas major, is on the pelvis. And that means all hip flexors are anterior tilters. Can you really exaggerate that, Sam? Anterior tilters, relax down now, of the pelvis at the hip joint. How do we stop anterior tilt? With a force of posterior tilt of the pelvis. Who can do posterior tilt of the pelvis? The anterior abdominal wall musculature, specifically rectus abdominis, external abdominal obliques, and then internal abdominal obliques. Any anterior abdominal wall musculature that has any vertical component to their line of pull. Therefore, as before, given the fact that this exercise is done where she's always up in flexion, we're always engaging the anterior abdominal wall trunk flexor musculature. And that's always isometrically contracting to stabilize the pelvis, to stop the pelvis from falling into anterior tilt. But now it gets fascinating. If she brings her thigh over to the opposite side of the body, we are adducting the thigh at the hip joint. So certainly we're engaging hip joint adductors. But a couple of things are happening here. This is really not adduction. This is called horizontal adduction. And horizontal adduction is actually a transverse plane motion. And what's happening here is the center of weight of her lower extremity is shifting to the side, and that's going to, if she doesn't stabilize her pelvis. Now, Sam, would you put your hands under your head so the camera can see this better? That's going to make the pelvis rotate to the opposite side of the body from the leg that's moving, from the leg that's doing the circles. And to stop that rotation, contralateral rotation, she will now need to engage rotation musculature of the trunk that's crossing the lumbosacral joint to the pelvis, as well as rotation musculature of the thigh that crosses the hip joint to go on to the pelvis. Now, when she then comes toward the outside, and beginners don't go very far outside, but as they get more proficient, as she comes more outside, this is horizontal abduction, again in the transverse plane, and that would make the pelvis rotate toward the same side of the body as the moving leg, the leg that's doing the circle. And again, now we have to stabilize the pelvis in the transverse plane for the opposite rotation. So we now have added in not only sagittal plane stabilization of the pelvis, but now we've added in transverse plane rotation of the pelvis. Now, as the person becomes stronger and the circles can get larger, there's going to be a point where she's lower down. And when she's lower down and coming across on the opposite side of the body into adduction, this is really more of a pure adduction motion in the frontal plane, coronal plane. And when the adductors contract to pull the thigh across into adduction, they would actually tend to elevate the pelvis on that side, and or if she's inflexible, going across might depress the pelvis on this side. So the pelvis could be challenged in two different ways in the frontal plane. So now the client needs to stabilize the pelvis in the frontal plane. And before we go into what muscles would work there, let's make the point that when she comes across into abduction and she's low down, again, more of a pure frontal plane abduction, again, there's a challenge on the pelvis in the frontal plane. If she's not flexible in her adductors, it could pull her into elevation over here, or because she's abducting she's engaging these abductors out here, their reverse action would be to pull the pelvis down in the frontal plane. So depending on flexibility or engagement of muscles, we're now engaging on the outside here and challenging the pelvis in the frontal plane again. So how do we stabilize the pelvis in the frontal plane? Well, if you want to stop, and we'll show it for the right side pelvis, if we want to stop the pelvis from depressing on the right side, we need a force of elevation of the pelvis on the right side. And that could be done with the quadratus lumborum, QL, or any other extensor muscles on the right side that are out to the side because they are lateral flexor muscles. When they go onto the pelvis, they would pull the pelvis up. Therefore, they would stop the pelvis from depressing. How would we stop the pelvis from depressing on one side? Well, we could do it with engagement of the adductors, and notice that Simona made a point that she's always engaging those adductor muscles, which can help to stabilize there in the frontal plane. And we can also stop the pelvis from depressing on the right by having a force that pulls the pelvis down on the other side, which would be abductor muscles like gluteus medius, upper fibers of gluteus maximus, also gluteus minimus, TFL, sartorius. So we have one more piece, and that was that it was said that when we're up here, we're not just necessarily parallel, we might have a little bit of turnout, which is lateral or external rotation of the thigh at the hip joint. And if we're holding that statically, even as the circle is being done, then we have an isometric contraction of lateral rotators of the thigh at the hip joint, namely the upper fibers of gluteus max, the posterior fibers of gluteus medius and gluteus minimus, and the piriformis and the other deep lateral rotators, superior gemellus, obturator internus, inferior gemellus, obturator externus, and quadratus femoris. So, as with all Pilates exercises, there's so much going on throughout the entire body. But what I really want to emphasize for this exercise, the first time it's introduced in the traditional mat sequence, is that not only is it asymmetrical, but we introduce transverse plane and frontal plane challenges to the pelvis. So the stability is now no longer just sagittal plane, but in all three cardinal planes.